Okay, it's gone live on Facebook, I believe.
Should we start now?
Yep, you can start now. Hang on. Yes. Okay, Chu.
Hi everyone. My name is Chu Yim Kuen, and I am the moderator for this talk today. And first of all, I'd like to welcome everybody who is now logged in into this webinar now. And a brief introduction of our society. We are officially called Persatuan Kesedaran Osteoporosis Kuala Lumpur dan Selangor. In short, we are known as OASKLS, which is Osteoporosis Awareness Society of Kuala Lumpur and Selangor. We have been around for more than 10 years now. And over the years, we have been carrying a lot of awareness campaign around the country, even right up to East Malaysia, Sabah and Sarawak. We have reached out to a lot of people from the rural area and just to create awareness. And in the meantime, to also give consultation pertaining to the status of the bones and also to do bone scan. However, due to the current pandemic, as we all know, we are not lagging behind. We are following the norm now, the new norm. We have decided to embark on webinars. Again, the purpose of these webinars are to create awareness to the public in general, and it's free for all. Without much ado, I would like to introduce to you our panel of speakers, Dr. Terence Ong, Ms. Chia Min Hui, and Mr. Mok Chu Zin, who are going to give us some insight about dieting, supplements, and of course about osteoporosis. I start with Dr. Ong. Dr. Terence Ong is a consultant, is a consultant physician in geriatric medicine and internal medicine lecturer in the Faculty of Medicine, University of Malaya. He's also a committee member of OASKLS, and besides being active in OASKLS, Dr. Ong is also active in other organizations. He's a member of the International Society for Clinical Densitometry, or in short, it's called ISCD, Asia Pacific Regional Panel, and the International FFN Vertebral Fracture Specialist Interest Group. With his vast experience, Dr. Ong would like to share with us what osteoporosis is and why healthy bone is very important. Dr. Ong, yes, what is osteoporosis and why is healthy bone important?
Thanks, Ms. Chu. So while I get my slides up, I just want to thank again the OASKLS for putting this together. Right, here we go. So I've been tasked by very much just doing a very quick run through, a quick summary about this idea of healthy bones for life and the need to tackle something called osteoporosis. So essentially, all I want to do is try and answer 4 questions. First one is what bone is. Second question is what osteoporosis is, why we need to bother about it. And the last question is if we feel we want to do something about it, what can we do about it then? So we'll start with the first question. I think this is one of the most fundamental questions, which is what bone is. So bone is a living tissue, very much the same way we think about our brain, our heart, our lungs, our stomach. Bone is a breathing, living tissue. It's made up of collagen, which is a type of protein, calcium, and a number of minerals and trace elements. Okay. Now, bone isn't a solid piece of tissue like a brick, okay? Because if bone was a brick, our bodies would be very, very heavy. We wouldn't get anything done. We would just be very stationary, okay? So bone isn't a solid piece of tissue. It's got an outer thicker shell, which we call a cortex, and then we have got an inner mesh called a trabecula. So you have the thicker cortex up here, and you have got the mesh that's inside it, which has got little holes in it. And that's what bone is essentially. Now, bone changes throughout life, okay? Bone doesn't remain static. We can see as we are born, our bones are very much just around here. As we get older, bones get bigger, bones get longer, bones get stronger. Men uh, will eventually reach bigger, stronger, and longer bones than women. But bones do grow all the way up till our late 20s, until we reach what's called our peak bone mass, somewhere in our mid 20s. So I can remember growing up as a child, I wasn't very tall. So my mom would give me, what's it called again? That sort of peanut root tree soup thing to drink, because she believed that that would help my bones grow bigger. Because I was the shortest boy in class, and maybe Mr. Mock, our dietitian, later can tell us whether my mom did the right thing or not. But you can see how bones grow all the way from when we are born till our late 20s. And the idea to ensure healthy bones in later life is to make sure we reach what our peak bone mass is supposed to be. And each of us have a predetermined peak bone mass already, which is sort of genetically determined. So if your parents are tall, chances are you are going to be tall. If your parents are not tall, chances are you're not going to be very tall. Okay? And until our late 20s, into our 30s, and as we approach our 40s, bones very much what we call consolidate itself. After our 40s, and that's where things do start to decline. You can start to see in women and in men, bone declines as we get older. In women, there is this period during the menopause where bone decline accelerates. And we sort of quote around a 2% annual bone loss during the menopausal period. And just to put that into perspective, for men, we lose somewhere between 3 to 5% over a decade, over 10 years. So what we see happens during menopause is highly accelerated bone loss within those 5 years or so. Okay? And if you want to think about healthy bones throughout life, it's sort of perhaps the same way we think about retirement, where it's all about when we are able to bank as much bone as possible, so that in later life, as bone starts to decline, we have a bit more bone in the bank to work with. So what determines our bone health? I've sort of alluded to this already, which is the first thing is to reach what our peak bone mass is supposed to be. And that's obviously genetically driven. There is certainly good evidence these days that what happens even as the child is in the womb has an impact on what this child's bone health will be later on in life. So this whole womb to later life concept of bone health is very important. So with pregnant mothers, we always counsel them to ensure that they take the right things that they need to take to ensure that the unborn child will have the best possible bone health in later life. The choices that we make, and the two that come straight to mind is things like smoking or alcohol, also determine whether we hit our peak bone mass or not. So we have, say, teenagers who perhaps pick up smoking, then they certainly would be less likely to hit what your peak bone mass is supposed to be. Some children, some adolescents, unfortunately suffer ill health, and being ill as bone tries to grow and hit its peak bone mass also would start to have an effect. Where I used to work, in osteoporosis clinic, and we saw quite a lot of younger folk who come to our clinic with a poor bone health as a consequence of eating disorders. So they had anorexia, they were bulimic, and that again affected that particular issue. And then if we start to think about the later life and so forth, ensuring that the rate of bone loss is as slow as possible is important. Okay, so we talked about menopause being a phase where bone decline accelerates. Early menopause, that's not good. Any coexisting medical conditions or a certain medication that one takes could also influence how quickly bone declines in later age. And again, lifestyle choices is one of those things that is important throughout the entire lifespan as a very big factor in ensuring healthy bones. So that's in a nutshell what bone is. The second question is, what then is osteoporosis? Well, the easiest way to think about it is bone thinning over time. And if you remember how we talked about bone consisting of thicker shell, the cortex, and the inner meshwork of the trabecula, you can see how with time, bone gets thinner and thinner, and you see little cracks forming, little gaps starting to develop. So osteoporosis is essentially when the body loses too much bone over time. And as a consequence of bone becoming less dense and less compact, it becomes weaker, brittle, and more fragile. And this is one of the key things here. Our bones thinning, well, it doesn't give us any symptoms. We don't feel poorly as our bones get weaker and brittler. And perhaps a good parallel to think about is, say, high cholesterol. For many of us, we don't know we have high cholesterol until, say, we go into a particular health screening, we do a blood test, and as part of that test, we checked our cholesterol and hey, our cholesterol is high. Osteoporosis manifests in very much the same way. We don't feel our bones getting thinner. It doesn't make us feel poorly, doesn't make us feel sick, doesn't make us feel ill. So for many people, we don't really know that we may have osteoporosis as it develops within us. Where people have looked at osteoporosis in a screening for osteoporosis, it's actually fairly common, affecting about 1 in 5 Malaysian adults. So you can do the maths and have a think of how many, I don't know how many participants we have in this webinar at the moment, but around 20% of us, chances are, may or already have developed osteoporosis. Okay? Importantly, osteoporosis is not a joint problem. Okay? Joint problems have its own condition, and the most common joint problem that we hear about is something called osteoarthritis. And osteoporosis is a very different problem altogether. Okay? So this is what osteoporosis looks like. So if I were to take a piece of bone from, say, someone's spine, this is what someone without osteoporosis's spine would look like. Okay? And this is a picture of someone who does have osteoporosis. So you can see the holes in the bone. This meshwork, that netting, that trabecula is much less, thinner. And if you imagine, this is your spine, and all this part of bone is the one that gives, what's the word for it, helps support the weight of the body. This particular vertebrae is struggling to, so you get this indentation here already, because everything underneath it is now just a piece of hole. Okay? And that's how osteoporosis can look. Okay? And coming back to an earlier point, we don't feel this happening. We don't this happens. Okay? So the third question is, why is this important? Well, it's not osteoporosis that is the big problem. It's what osteoporosis can do. And what it leads to is fracture, broken bones. Okay? That's the problem with osteoporosis. Now, broken bone. Now, I'm slightly fascinated with climbing coconut trees because I grew up not very far away from the beach. Okay, now if I were to climb a coconut tree and I fell off climbing up and I break a bone, that is to be expected. Okay, falling off a coconut tree and breaking a bone is something that many of us wouldn't be surprised if it happened. But breaking a bone, say just slipping on a wet floor, and then you break, say, a very big bone, a supposedly very strong bone like a hip. Now that tells us that perhaps the bones just are not as strong as they supposed to be, that it's struggling to sustain the impact from what many would consider a trivial fall. And that's usually the first sign of osteoporosis, and that's also usually the complication of having osteoporosis. So common sites that could break with osteoporosis. This is a picture of someone's pelvis, and here you have someone's broken hip, and you can certainly see this crack just about here between these two bones. This is a picture of someone's wrist, and again you can see this crack has opened on this particular bone. The last X-ray image I've got for you, this is someone's spine. This is looking from the front, and this is looking from the side, and you can see how nice and square each vertebrae should be. Then you've got one that looks like that. Okay? And these are all complications of osteoporosis. So fractures due to osteoporosis happens after little or no trauma, and we call this a fragility fracture, a fragile fracture. One fracture tends to lead to another fracture in someone who has osteoporosis that isn't treated. Okay. I look after many older people, and for some reason we sort of accept that breaking a bone in older age is normal and part of an aging process. And if you take nothing away from today's webinar, is that that is not true. Breaking a bone in older age is not normal and shouldn't be accepted as such. Commonly, it indicates underlying osteoporosis. And this is the piece of statistics that I've just pinched off the International Osteoporosis Foundation website, which again highlights what a big problem we have facing us today. So around the world, 1 in 3 women and 1 in 5 men over the age of 50 will suffer a broken bone due to osteoporosis. The challenge is this is all hidden because osteoporosis doesn't make us feel poorly until a broken bone happens. So, what can I do about it? Okay, and to answer this, let me ask some more questions. So the first thing you can ask yourself is, am I at risk of osteoporosis? That's the first question to ask. Now, this is by no means a comprehensive list, but these are what we call risk factors for osteoporosis. If you have some of these problems or issues or condition, it does make you more likely to have osteoporosis. Older age, being women, having a family history of osteoporosis or a fragility fracture, smoking, excess alcohol, inadequate calcium or vitamin D intake, a low body mass, okay, someone who's underweight, having an early menopause because that kicks off that progressive decline much earlier, And there are certain medical conditions and medication that does contribute to the development of osteoporosis. Having answered this question and said, perhaps I am at risk of osteoporosis, then the next question to ask yourself is, do I have osteoporosis? And the way we do it is with something called a DXA scan. Okay, it's a type of X-ray, but has less radiation than a conventional X-ray, which is why, like this picture here, the technician sits with the person in the scanning room to facilitate the scan. It's painless, it takes very little time, and results do become available more or less once the scan becomes completed. Okay, and many hospitals have the DXA scans. And let's assume that there is osteoporosis, or you're just thinking about keeping your bones healthy in general. What can you do? And to break it down, it's essentially 4 simple things that we need to always remember. Okay, adopting healthy measures, focusing on exercise, optimizing our nutrition, and obviously there is the role for drugs and supplementation in keeping our bones healthy. But if you look at health measures alone, stopping things like smoking and moderating alcohol consumption is a step in the right direction. Sometimes I say to patients, you know what, to treat osteoporosis, if you stop smoking, that's actually more effective than taking a drug. Maintaining an optimal weight. And we also know that if you are one of those patients who develop osteoporosis as a complication of an underlying medical problem, if you can get that particular medical problem better, the osteoporosis also becomes better. Okay? And some of these conditions like eating disorders, rheumatoid arthritis, epilepsy, any conditions that require long-term steroid use, strokes, these are all associated with developing osteoporosis. Nutrition, I wouldn't talk too much about this because I don't want to steal the thunder from my other 2 panelists, but eating the right things is absolutely crucial. And the Ministry of Health has published a report a few years back. And when we look at nutrition specifically for bones, it's something that we don't have enough as a nation in Malaysia. Exercise is important. We know that weight-bearing exercises like jogging, tennis, dancing, if that is your cup of tea, if that's what you like to do, can help improve bone health. Exercise also improves balance, strengthens your core, makes you less likely to fall, and in addition to just making you feel healthier. So exercise is a good thing. The WHO recommends 150 minutes per week, and that's something that we do encourage. You might say to me, 150 minutes per week seems like a lot. Well, some exercise at the end of the day is still better than no exercise. So do as much as you can. You do need to adopt certain precautions if you already have existing fractures. So let's say you've broken your leg, and dancing and jogging and tennis might not be so easy for you. So these are things that you may want to seek professional opinion about how to incorporate exercise if you have got certain disability as a consequence of whether it's a health condition or a pre-existing fracture. Okay. And of course, there are drugs. There are drugs to treat any condition, and osteoporosis is much the same. There are lots of them. You've got tablets, they've got injections. Although the tablets represent the most common type of drug that we give for osteoporosis, which particular type of medication is very much an individualized decision. So it comes to the discussion between the person and his or her doctor to decide what's best. And usually when we treat osteoporosis, we always ensure there's adequate calcium and vitamin D, and the role of supplements is usually talked about in the same consultation. But the point is that drugs for osteoporosis work. They do make bones stronger, they make bones more dense, and they also reduce the risk of that bone breaking by about 40 to 60%. This seems like a very obvious thing to say, but treatment for osteoporosis only works if you continue to take the medication. And this becomes a challenge. And I'll give you an example. When we talk to patients who say have got heart disease or lung problems, they know that if they don't take their medicine for their heart or their lung, they feel poorly, they get breathless, their heart starts to ache up. And that motivates them to take their drugs. With osteoporosis, it can be a bit more challenging because we don't feel our bones losing mass. We also don't feel our bones putting on mass. And a lot of the time, because they don't feel any different, it makes it so easy to forget taking the medication. But the bottom line is, drugs only work if you continue to take it. And that's why, just like how we monitor diabetes, how we monitor high blood pressure, how we monitor high cholesterol, osteoporosis does also require some element of monitoring, review whether the drug is the right thing or not, if you've got side effects, what other options are there. Very much similar to the way we treat other chronic illnesses. So this is my last slide. So this is really my summary slide. A quick whisk through about bones and bone health and osteoporosis. But the bottom line is, the first thing to remember is the healthy choices that we make throughout life, from the moment that we are born to later age, very much affects the health and the condition of our bones. The importance of maintaining healthy bones is so that we prevent fractures from happening. So consider your own bone health. Be proactive. Ask yourself those questions. Are my bones as good as they should be? Am I at risk of osteoporosis? Do I have osteoporosis? And a lot of this does involve being proactive in nature. Okay? Osteoporosis is very common. That's why it's something worth thinking about. And my last point is this: that osteoporosis, if you do have it, can be treated and can be treated very effectively. Okay, so I'm going to stop there, and while I let you digest all that information, details are up there, but I'll hand the time back over to Chairperson Ms. Chu.
Thank you so much, Dr. Ong. You know, listening to what you said just now, it really is scary for a fact that, you know, osteoporosis, there are no signs and no symptoms. You know, you would just, the only symptom is when you break your bones.
Yeah, and that's the unfortunate thing, where the first time we pick up osteoporosis in many of our patients is after they've broken the bone, because they've had a trivial fall, they slip on a rug, or they trip while playing with their grandchildren, they break their hips, and then you pick up osteoporosis.
That's scary, because that's the only time you know that you're also you have osteoporosis.
So be proactive. I think that's the message to get across. Think about your bone. Be proactive.
Yeah, correct. And also, you're talking about 150 minutes of exercise. Really, if you ask me, it's very short time in a week. You know, there is no excuse for not doing it. Just saying.
I think absolutely. It's not a lot of time, but recently I bought one of these physical activity watches lah. And the beauty of it is I get to see how much exercise I'm doing, and these days, because of how busy work is, I am guilty lah of not doing the 150 minutes. But it is doable if we want to invest the time into it.
It is definitely doable. Yeah. All right. Thank you so much, Dr. Ong. And for the information of viewers and and everybody who is on this Zoom, we will open for questions after the panelists have spoken. Yeah. Okay. The next that is going to talk about related to osteoporosis is Mr. Mok Chu Zhen. A brief introduction about Mr. Mok. He's a dietitian attached to the University of Malaya Medical Center with vast experience in educating and evaluating people to eat well, and especially for patients Mr. Mok is perhaps one of the best person to highlight to us the type of food best suited for people with osteoporosis, or how to prevent an osteoporosis situation, and how to strengthen our bones. Mr. Mok was formerly attached to the Putra Specialist Hospital in Batu Pahat and is currently with UMMC as a dietitian. Mr. Mok, the mic is open to you now.
Thank you, Ms. Chu. But perhaps you can allow me to start video because I'm currently stopped by the host. So is there anyone can help me with that? Okay, never mind. Probably we just start.
It's open for sharing.
Okay, can you see me?
No. Sorry about the hitch.
Hang on a minute.
Okay, I think I'm on, but I think
Yes.
my video is actually blocked by the admin. Probably you can help me with that. So they can't see my face now. They don't know who am I. Okay, start my video. Okay, thank you very much. Okay, thank you, Ms. Chu, for the introduction. Good afternoon to all the viewers on Facebook and Zoom. My name is Mok Susan. I'm a clinical dietitian from University Malaya Medical Center. So today I'm going to share with you a bit of information relating how eating well is going to help us to get healthy bone. Okay, so the outline for today will be the nutritional factors that affects our bone health. We always talk about calcium and vitamin D, but that is not the whole story of it. We need to look into factors that can affect our bone health. So we'll dive in one by one. Like what Dr. Terence mentioned just now, the peak bone mass is actually predetermined by the genetic. However, not to forget about the lifestyle choices, which will influence about 20 to 40% of our adult peak bone mass. So therefore, optimization of lifestyle factors is an important strategy for us to reduce the risk for osteoporosis and low bone mass at later of our life. So what are the factors that can affect our bone health? We always talk about calcium and vitamin D. Yes, that is the most important topic. However, not to forget about our body weight. Whether are we taking balanced diet? What about our protein intake and salt intake? Those intake can actually affect our bone health as well. So in our country, there are 5 out of 10 Malaysians are overweight or obese. So looking at us, maybe half of us are overweight. Okay. Overweight or obese is usually associated with lacking of physical activity. So everyone knows that we need vitamin D for our bone health. The best way to get vitamin D is to go out from our house to get the direct sunlight. So when you are lacking of physical activity, it's very difficult for you to get enough vitamin D. At the same time, obese individuals usually have higher intake of empty calorie foods and drink. Empty calorie foods means that it is the food or drink that provides a lot of calorie without any nutrient. For example, carbonated drink. So within soft drink, we get calorie, we put on weight, but there is no nutrient in it. So unlike drinking milk, probably we get calorie, at the same time, we get calcium in it. Obese individuals also have different physiological changes. It will actually alter the bone cell metabolism and affect the bone health. Same thing goes with the underweight. People with underweight or anorexic, they might not be taking enough food to sustain their life. Their food selection may be limited to certain food group. Some people, they don't eat certain food, so they might not be even getting enough calcium. How do we know whether we are healthy body weight? The easiest way is to calculate your BMI. Calculating BMI is simple, dividing your body weight in kilogram by height in centimeter for twice. So we get a figure. For a normal healthy adult, the BMI should be in between 18.5 to 24.9. However, the story is a little bit different for older person. For older person, we are allowed to have slightly higher BMI in between 23 to 30. Why? Because research shows that for individual older person, the BMI is lesser than 23, the risk for osteoporosis is much higher, especially when you are thinner. You do not have enough lean muscle mass for you to go out exercise. There is nothing to support the bone. So that's why the risk for fracture and falling is much higher. Okay, in order to maintain healthy body weight, you need to adopt a healthy and balanced diet. It is not always calcium and vitamin D, although they are extremely important. In old days, you might heard about food guide pyramid, a pyramid that teach you what kind of food you should be eating. But a lot of people actually feedback to us, we don't eat on a pyramid, we eat on a plate. So nowadays, we started to educate our public using healthy plate. Probably you have heard about it before, suku separuh, you can hear from the radio or on the TV. So when you're eating a healthy and balanced food, a quarter of the plate should be the protein. Another quarter should be our cereal, for example, rice or noodles. Half plate of it should be the fruits and vegetable. Okay, so with this nutrient-dense food plate, we get all the nutrients that we need. Like what Dr. Terence mentioned just now, bone is not only calcium. There is a collagen protein that hold the bone together, hold the calcium together. So in order to produce enough collagen protein, we need vitamin K, we need magnesium, we need the protein itself. So by adopting a balanced diet, we get all the nutrients that we need to support the healthy bone. Okay, so let's talk about the most discussed topic, which is the calcium. So calcium is the fifth most abundant element in our body. For an adult, we have around 1 kilogram of calcium in our body. And calcium is not static in the body. It is dynamic. Every day we take in calcium, we ingest food with calcium, it is absorbed. It could be lost through our urine. So that's why we need to take enough calcium. The dietary calcium requirement for an adult or a teenager will be different because it is age specific. For example, for teenagers, they are trying to achieve their peak bone mass. So they need a lot of calcium. They need about 1,300 milligrams of calcium. When you grow older, probably after the age of 50, you need more as well, especially for female after menopause. So in average, we need about 1,000 to 1,200 milligrams of calcium in a day. Are we taking enough? Definitely no. Looking at Malaysian Adult Nutrition Survey in 2015, let's take an average of 1,000 milligram requirement in a day. We only take 357 milligrams of calcium every day, which means we are not taking even half of our requirement. This is worrying. Like Dr. Terence mentioned just now, we don't know if we are osteoporotic. So if you are not taking enough calcium, our peak bone mass is lower. We can foresee in the future, we can be osteoporotic. We can have risk of falling and hip fracture. So that's why we really need to take enough calcium from our diet. So where do we get all the calcium? People mostly talking about milk and dairy product. Yes, they are a good source of calcium. But not to forget about plant-based source of calcium as well, like dark green leafy vegetable, nuts and seeds, soybean product. So they are all good source of protein. Okay, so when someone is having osteoporosis, you might hear from your neighbor, from a friend to tell you, oh, you have to drink soup, especially for Chinese. We prepare soup with bone. We boil the soup for 3 hours, 4 hours, and then we drink the soup with the hope we can get calcium from it. But actually, no. Calcium from the bone is not going to dissolve in your soup. So no matter how much soup that you drink, it's not going to get you enough calcium. We need to take the bone itself. but we are not going to chew a bone like a dog. So that's why we can get some small bone from the anchovy, ikan bilis, or sardine. It's very simple. If you have stir-fried vegetable, you just add in anchovy, the ikan bilis, to stir-fry together. So if you are taking the anchovy, you are getting the calcium. 1 cup of anchovy will provide you with 192 milligrams of calcium. So it is quite a lot. Okay, so now we don't add ikan bilis to all our dishes. So we have to look into something that we can take in a regular basis, which is milk and dairy product. A glass of milk usually contains 300 milligrams of calcium. Just remember, we need about 1,000 milligrams of calcium in a day. So taking 2 to 3 servings of milk will be enough for our calcium requirement. Same thing goes with our yogurt. 1 cup of yogurt will provide 300 milligrams of calcium. Cheese, like cheddar cheese, Parmesan cheese, a slice of cheese will provide 150 to 300 milligrams of calcium. But there are certain food manufacturers actually add in more calcium into the milk. So there are certain brands that provide more than 500 milligrams of calcium in a glass of milk. You can always refer to the food labeling. When we recommend to take 2 to 3 servings of milk in a day, many people ask me, what about lactose intolerance? Lactose intolerance is very common in Asian, like you and me. There is a reason behind it. Because when we are getting older, we stop drinking milk, we stop taking dairy product. Our body will reduce or even stop the production of lactase, which is the enzyme to digest the lactose. So when we cannot digest the lactose, it will be fermented by the bacteria in our intestine. So you started to feel bloatiness, you might have stomach discomfort or even diarrhea. So for my patients with osteoporosis or whoever needs extra protein or calcium, I would ask them, do you want to try on daily product? If they say yes, I will help them to go low and go slow. At first, we can try with the food which has lesser lactose. For example, cheese and yogurt. You might start with half slice of cheese. After a week or 2, if it is all right for you, you can slowly increase to 1 slice, and slowly you can take cheese, yogurt, and then you can take milk at the end. I will also recommend them to take the milk or daily product together with their meal time. Why? When you are eating, you have chicken, you have fish, you have vegetable. So all the food will slow down the digestion of the milk. So it gives time for the stomach and the intestine to digest the lactose properly. So you have lesser symptoms. If you are vegan or you are not keen to start on daily product, you can look into dark green leafy vegetable. For example, watercress, sayong choy, which is very common in Chinese soup, kailan, sawi, or even kacang boto. Our Malay friend usually take it like ulam, so they eat it raw. So there are also issues with green leafy vegetable. For example, it is not easily absorbed. That's why we need a larger portion of green leafy vegetable for us to compensate the bioavailability so that we get more calcium from it. Like I mentioned just now, soybean product is also a good source of calcium. So tofu and tempeh can be part of your diet. Okay. If you have doubt, don't worry about the purine, because tofu and tempeh, they are not high in purine, so they won't be increasing your uric acid in the blood. If you are an Indian, dosa, chapati, idli is your staple food. So you can take it with curry dal, chickpea, or all sorts of lentils. They also provide good source of calcium. If you prefer Western diet, Western cuisine, if you take salad, if you take sandwiches more, you can add in almond, hazelnut, the seeds like sunflower seeds, sesame seeds into your food. Like I mentioned just now, we can add in extra calcium into the food. So that's why certain food like commercial food, cereal, soybean meal, wholemeal bread actually have higher content of calcium, but we have to look into the amount of it. So always look into the food labeling. this is an example of food labeling form. Okay, so when you buy a pack of milk, it is 1 liter. We don't drink 1 liter of milk at one go. So look at the serving size. It is usually 250 ml, which is a glass of milk. So if you drink 1 glass of milk, you are getting about 325 milligrams of calcium. So you know, if you are taking 3 glasses of milk in a day, you are getting enough calcium. And try to compare different commercial food. For example, if you are getting a cereal, different brand might have different content of calcium. Take the one with higher calcium content. Okay, we talk about intake. We need to make sure that the calcium is well absorbed. That's why we need to look into vitamin D as well. Vitamin D is a fat-soluble vitamin that will be produced by ourselves when we have direct sunlight to our skin. Our skin will convert the cholesterol into vitamin D. So the vitamin D will help to stimulate intestinal calcium absorption. It regulates the production of calcium transporting protein, meaning that the vitamin D is just like opening the door for calcium to come into our body and send the calcium to the bone. At the same time, it also reduces the loss of calcium from our urine. I have to be honest, it is very difficult to get enough vitamin D from the diet. Meat, poultry, vegetable, and even milk are generally poor sources of vitamin D. The best way is to be active, go out from the house to get the sunlight and be physically active. But if you're at risk of vitamin D deficiency, for example, if you're sedentary, you're not exercising, you are darker skin, because darker skin people tends to have lesser sensitivity to the UV light, so they don't produce enough vitamin D. Or if you are obese or vegan, you may consider to take vitamin D supplementation, when Ms. Cha will talk about it later. Okay, so the vitamin D requirement is also age specific, but we need about 10 to 15 micrograms in a day. It is usually found in fish, in the fish. So salmon, Spanish mackerel, like ikan tenggiri, they are high in vitamin D. Try to incorporate the fish in our diet, like maybe 2 to 3 times in a week. Okay, if you are vegan or vegetarian, you can take shiitake mushroom to get the vitamin D, but I don't think we take the mushroom every day. So exercise is still the best way to get vitamin D. Okay, we talk about intake, we talk about the absorption. We need to make sure that the calcium is not going to lose through our urine. We need to keep all the calcium in our bone. So what is actually influence the urinary calcium excretion? The culprit is actually the salt intake. The more salty food that we eat, the more calcium will be excreted in our urine. Easily by 1 teaspoon of salt intake every day will actually lead to 40 milligrams of calcium excretion in the urine. So try to cut down your salt intake by reducing the gravy intake, reducing the snack which is high in salt, and also don't be too generous in adding in the salt or any flavoring agent in your cooking. Apart from salt, caffeinated drink or carbonated drink, they are also affecting our bone health, especially like, for example, caffeine. If you're taking too much of caffeine, it will excrete more calcium and you inhibit the absorption of calcium. What about carbonated drink? If you're taking carbonated drink, the phosphorus in the carbonated drink will actually draw the calcium from the bone and excrete it through the urine. So that's why if you're talking about fluid intake or beverages, we usually recommend you to have less than 2 servings of caffeinated drink in a day. Okay, last but not least, the factor that can affect our urinary calcium excretion is the protein. Like for example, chicken, fish, egg, tofu. If you are not taking enough protein, you cannot stimulate the acid release in the stomach that is important for the calcium absorption. But if you're taking too much of protein, it will actually increase urinary calcium excretion. So that's why moderation is a key point when you are talking about protein. It is quite sad that we are seeing a lot of people trying to take other protein for the exercise or maybe for the gymmer, it is okay to take slightly higher amount of protein, but not too much of it. Okay, so in summary, it is important to adopt healthy and balanced diet for our overall bone health. It is recommended to consume 2 to 3 servings of milk and dairy product to achieve dietary calcium requirement. If you are vegan, you may consider plant source of calcium. Remember to include 3 to 5 servings of green leafy vegetable every day, and not to forget about salt. Cut down your sodium intake every day. I think that's all from me. I will pass the stage to the host and also continue with the session later. If you have any question later, we can discuss during our Q&A session. Thank you.
Thank you, Mr. Mok. Actually, I'm shocking to see the percentage of people taking calcium in Malaysia, because looking at our normal daily diet, right, it looks like we're supposed to consume a lot of calcium, like ikan bilis. These are all our local food.
Yes, that's true.
But I'm surprised with the figure.
Okay, so looking at the figure, the factors is actually milk consumption. Most people don't drink milk that much. This is one thing, because we need more milk in order to achieve the requirement. Even for the ikan bilis, like I said, 1 cup of ikan bilis will provide you around 200 milligrams of calcium, but we don't eat a cup of ikan bilis, right? It is just like maybe 3 or 4 to stir fry with the vegetable.
Yes.
So that is why we need to be aware that we are lacking of calcium and try to incorporate more food which is high in calcium in our diet.
Good insight. Thank you, Mr. Mok.
Welcome.
Yeah. Okay. Last but not least, our next speaker is Ms. Chia Min Hui. Ms. Chia is an experienced pharmacist. She's currently a postgraduate researcher at University of Malaya. She was attached to Hospital Banting during her early years, and then went on to join Hospital Sultan Haji Ahmad Shah in Temulor as a full-fledged pharmacist. Am I right, Ms. Chia? Yeah. She also worked as a local in a local pharmacy and has experience dealing with consumers generally. She'll be talking to us on the types of supplements for bone health generally.
So hi all, thank you Ms. Chu for the introduction. I'll be putting out my screen. Okay, so hi, I'm Min Hui. So I'm a pharmacist and I'll be talking on taking supplements for bone health. The topics that I'll be covering are what are supplements, and then type of supplements that we can take for osteoporosis or for our bones, and then what we need to know about them. Is it the dose and then side effects? And last but not least, how do we choose supplements? So first, what are supplements? Some people might actually mistaken supplements with medications. Supplements, if according to the US Food and Drug Administration, is actually products taken by mouth that contain a dietary ingredient. So by this, it means that the things that we can get from a supplements is actually some ingredients that we can obtain from our diet. So for example, it's like proteins, minerals, and also vitamins. So it's like our calcium and our vitamin D, they are all considered that supplements because we can actually obtain them from food also. So we're taking supplements just because we want to add on to all these minerals and also vitamins. So dietary supplements are not intended to treat, diagnose, cure, or alleviate the effects of diseases. It's mainly to lower the risks of getting the diseases. So for example here, so for osteoporosis, we always talk about calcium and vitamin D. So does this mean that if we are diagnosed with osteoporosis, so I just take calcium and vitamin D and that's the end of it? No, it's just to lower the risk of getting this osteoporosis and also to supplement your bone health, even if you are diagnosed with osteoporosis. But you still have to take some anti-osteoporosis medications in order to treat the conditions. So don't just go thinking that, okay, I'm taking calcium and vitamin D, so I don't need to take anything else for osteoporosis. It's done. Supplements are not meant to be used like this. So what can I take for my bones? Is it calcium and vitamin D? Is it vitamin K2? Or is it glucosamine and chondroitin? Or in other words, while sure more people are familiar with the brand. So we should see calcium and vitamin D. Yeah, as Mr. Mok has mentioned just now, they have very extensive studies to support the use of calcium and vitamin D in osteoporosis and for our bone health. And if you are those that like to go to like pharmacy, then you will tend to see now there are more supplements. They are combining calcium, vitamin D, and also vitamin K2. And pharmacists might be telling you, yeah, now vitamin K2 is gaining attention and you should take this combination together. But based on the evidence, so far K2, the main studies are from Japan. It's approved for use for osteoporosis in Japan, but no data, the data is still conflicting, and no data has been demonstrated the benefit in other populations. So we will not suggest the routine use of vitamin K for bone health yet, as there are not enough evidence. As for glucosamine and chondroitin, it is mainly for your joints. Like just now, Dr. Terence have mentioned, it's for our joints. It's something called osteoarthritis. It's not osteoporosis. It's totally different disease. So it's not for your bones. Do take note of that. And how do they help? Calcium and vitamin D, they can help to keep our bones strong and prevents bone from breaking easily or prevents fracture in this term. So do I actually need to take? You might be asking, does everyone needs to take this calcium and vitamin D, or is this just for like older people or how? So we should see calcium and vitamin D supplementation in individuals who already have adequate calcium intake and normal vitamin D levels is unlikely to be of benefit. This means that if you are getting enough calcium and your vitamin D level is normal, you're actually not likely to gain benefit from this supplementation. However, calcium intake remains low in Malaysia, and vitamin D deficiency is very common among Malaysians also. So like what Mr. Mao has shown just now, I also have a calcium map by the International Osteoporosis Foundation here. We can see Malaysia over here is red color. Actually, most of the Asian countries are red, if you notice that. And red actually means that we are taking less than 400 mg of calcium intake per day. Yeah, this is likely due to our lifestyle. Like we don't tend to take cereal and milk for our breakfast. And you can see those Western countries, probably they have higher calcium intake that as they tend to take more dairy products and so. Another one is the vitamin D map. So we can see here also Malaysia is orange color. So it's more than 50 is the normal range of the vitamin D level. So for Malaysia is actually less than the normal range. And from study we can see that this study shows that the average vitamin D level is 44.4% in female, postmenopausal female. And there's actually another study showing that 41% and 87% of the male and female in the Kuala Lumpur area has vitamin D deficiency also. So this is the suggested daily calcium intake. So I believe this one Mr. Mo have shown just now. So I will just basically emphasize again, the suggested daily calcium intake is around 1000 mg for adults. So to make it easier, you just remember 1000 mg. Okay. So what is this 1000 mg? Because if you are getting calcium tablets from the hospitals, you will probably have seen this calcium carbonate or calcium lactate tablets. So you'll be thinking, oh, maybe doctors is asking me to take 2 tablets of calcium carbonate and then twice daily. So that will be 2000 mg. Wow, that's way past the recommended daily intake, but actually that's not the case of it. Don't be worried about that. Because this calcium carbonate, we have to see its elemental calcium. Inside 1000 mg of calcium carbonate, you have to times 40%. So there are actually 400 mg of elemental calcium only. And this is the one that we are mentioning about the 1000 mg per day of suggested daily intake. It is the elemental calcium that we are referring to, not oral calcium, because we have different types of calcium tablets. So their percentage of elemental calcium is actually different also. So as I've said, we usually get calcium carbonate or calcium lactate, but for supplements outside that we can get from outside, it's usually calcium carbonate or calcium citrate only. Yeah, you will not see the lactate and gluconate. The gluconate is usually for hospital use injections, so we will not be discussing it at all. So we'll only focus on calcium carbonate and calcium citrate. So what is the difference? For calcium carbonate, it's more widely available and is also cheaper. The absorption is better when taken with meals. So we always suggest to take the calcium carbonate with meals. As for calcium citrate, it's well absorbed both in fasting state and also taken with meals. The main difference here is if some of you are getting the gastric medications, such as the omeprazole, which is the Omaset also, or the other one is the esomeprazole, which is called Nexium. More people are familiar with that name. So we'll suggest those patients taking these gastric medications to take calcium supplements in the form of calcium citrate, because it will interrupt with the absorption of calcium carbonate. Okay. So another very important concern of people, especially like customers, when they do come to the pharmacy, when they want to get some supplements, they will definitely ask, will I get any side effects? And I've asked some other pharmacists out there, they have told me that their customers are very concerned about the side effects on kidney stones from the calcium supplements. So I will explain a bit about this. So kidney stones, there are actually a small increase in risk if you are taking calcium supplements, and dietary calcium will not increase this risk. So the first advice is, if you can get enough calcium from your diet, that's the best. So there's actually no need to take supplements if you can just get enough calcium from your diet. But if you couldn't get, so you might need some supplements, and you're worried about kidney stones, I will tell you, you can actually take calcium with food to reduce this risk, because how does kidney stones form? It's actually due to like calcium inside your urine. So if you are taking calcium with food, some compound inside the food called oxalate, they will actually combine with this calcium. So it will reduce the calcium in your urine and thus reducing the risk of kidney stones. And the small increase in risk here is actually very, very minimal also. So if you are advised to take calcium supplements by your doctors or pharmacists, do take it. Another very common side effects is gastrointestinal side effects, including like constipation and also stomach upset. For this one, you can just easily split the calcium dose to reduce the side effects. We usually won't recommend calcium supplements of more than 600 mg per dose. So if you are taking total 1000 mg, you can just split it into 500 in the morning and 500 mg at night. The most important point is, if a doctor has advised you to take calcium, do not stop your supplements on your own just because of afraid of the side effects and all this. Do ask your doctors or your pharmacist before you want to stop it. And for vitamin D, so as Mr. Mok has explained just now, vitamin D, it mainly comes from the exposure to sunlight. 70% to 80% of our vitamin D should come from the sunlight. But as we know, Malaysian, we tend to just hide inside our house instead of going out. So most of us are not getting enough vitamin D. And there are not many diets that can actually provide vitamin D also. That's why we might need vitamin D supplementation. And the suggested daily intake is actually 800 units per day. There are a few types of vitamin D. Vitamin D1, D2, and D3. But here we are not mentioning about D1. Why is that so? Because vitamin D1, later on, they actually found out that it is a mixture of compounds. It's not actually pure vitamin D. So now when we are talking about vitamin D, we will only focus on vitamin D2 and vitamin D3. And vitamin D3 has been shown to increase our serum. This is the vitamin D level in our blood. So the vitamin D3 will increase it more efficiently than vitamin D2. So for the supplements you can see outside at this pharmacy and all those, now they are using vitamin D3 only. It's unlikely that you will find any vitamin D2 supplements. So these are some examples of calcium and vitamin D supplements. So we can see just now I've mentioned that calcium carbonate. This is also calcium carbonate. So it's actually 1,500 and 1,666 mg here, but it's actually equivalent to 600 mg of elemental calcium only. So don't worry about overdose. And the usual suggested dosage is like 1 tablet twice daily. The dosage here is always just for the general population. That's why if you can calculate, if you are taking a lot of calcium from your diet already, you can actually reduce the dose to 1 tablet once daily. And we can see this, they usually give this in combination with D3. There are a few, there are different dosage of D3 here. So you can also choose the supplements based on the dosage that you want. And this one comes with vitamin K2 also, but so far there are not enough evidence to support the use of vitamin K2 for bone health yet. So this is the calcium calculator. So you can just easily go to Google and then just type calcium calculator. There are a few websites there with this calcium calculator. The one I'm showing is from the International Osteoporosis Foundation. So they allow you to choose your country and then you just click your gender and then whether you have osteoporosis or osteopenia and your age. And then later on, you just have to fill in the amount of supplements and also what are the food that you are taking. This is the amount that you are taking in 1 week. And later on, they will generate a result shown as this. They will show you what is your daily calcium intake and also what is your recommended daily calcium intake. So if this is your results, so you will see, oh, I'm actually lack of 500 mg calcium per day. So you can select those supplements with either 500 or 600 mg of calcium, then just take it. You can also see they actually provide you with this calcium-rich food table, so you can try to get more calcium from your food also. Okay, another common question: can I take my supplements together with my other medications? Because nowadays, most people are from some sort of medications, either for your blood pressure or for your blood glucose. So you'll be wondering, is there any interactions? So calcium and vitamin D, they do have interactions with some medications, but there's quite a list. So if you want to check whether the medications that you are taking now, does it has any interactions with calcium and vitamin D, you can always just consult your doctors or pharmacists before taking any supplements. Don't stop your supplements just because you are worried of these interactions or. And last but not least, how to choose supplements. I always have customers coming in asking which brand of calcium and vitamin D is good. This is a very common question, okay? But here I'm actually not telling you which brand is good or which brand is less good, because as long as you check their content, like what I have shown in the previous slides, you check their content and then you make sure they are registered with the National Pharmaceutical Regulatory Agency, or we call it NPRA. Usually they are safe and also they are effective. So there are actually not big difference between the brands, okay? So how do we know whether they are registered with this NPRA? This is actually a drug control authority in Malaysia. They control all these medications and then also supplements registration, all this. So if the product is registered, they will definitely have these two things, which are the registration number, or we call it MAL registration number, and also the Meditech hologram. So always check for these two things when you want to buy a supplements or any medications. They definitely have this. For this MAL, they will come with MAL in front and then 8 numbers followed by followed by an alphabet at the end. For supplements, it's always N for nagiri. Yeah. And there are a few other alphabets like A, T, and X for like medications, and then for other traditional medications, all those. So for here, I only focus on N. And if there are some other alphabets after the N, it's usually for administrative purpose. So no need to bother about that. You just have to focus on this. And for the Meditech hologram, it's always there. And this is the latest Meditech hologram by the Kementerian Kesihatan Malaysia, our Ministry of Health. Basically, if you are buying supplements from very proper source like pharmacy outside, it's like 99.99% is definitely the product is definitely registered one. So not to worry about that. It's just that if you are getting from some other source such as like online or friends, you know, so that one you do have to check for this. There's also another way that you can check for this, which is you can go search for the product in the NPRL website. I think you can just Google and type product registration with NPRA. Then they will come out with this website where you can key in your product name or product registration number. All this, they have a list of that. And then you can just search for it. As long as the product is listed here, means is registered with our Malaysian NPRA, our Malaysian government. Okay. So take home message. Do take your calcium and vitamin D supplements only if you are not getting enough from the diet. So you can calculate your you can calculate your calcium intake and also do a vitamin D level check to make sure that you are getting you are not deficient of it. Only if you are not enough, then you have to take, or when your doctor advises you to take, then you have to take it lah. And do not stop your supplements on your own. Make sure your supplements are registered. And last but not least, do consult your doctors or pharmacists before taking supplements. So that's the end of my presentation. Thank you.
Thank you, Ms. Chia. One question, Ms. Chia.
Yep,
You know,
sure.
this IOF calculator that you mentioned just now,
Yep.
is it advisable that we do it like on a random or everyday basis, or
you can just check in on random, because it actually asks you what is the calcium intake for your typical week. So it means you just answer it based on your typical week instead of like your yesterday's meal.
I see. And then, you know, you talk about, just now you did mention before you close that it's better to consult your doctor, you know, on the supplements that you want to take. But, you know, commercially, people don't care.
But because if you are buying all these supplements, you always will go to like a pharmacy outside, right? You can always ask the pharmacist there. So it's advisable to ask before taking.
Okay, got it. Thank you so much. Okay, well, I want to thank our panelists of speakers, and we are now open for questions. Anyone with the questions, please do type on the Zoom chat or otherwise on the Facebook chat. Now, I have one question directed to Dr. Ong. Good afternoon. Does bone density test helps to determine besides blood tests?
Hi, yes, I think that's a really good question. With regards to diagnosing osteoporosis, knowing whether someone has osteoporosis or not, the definitive way of doing it is with this DXA scan, or a bone density scan. So that is the only definitive way of knowing whether the osteoporosis or not. But concurrently, many doctors, when they ask this question, will also recommend a blood test. Okay, and the reason they will recommend a blood test is to see, is there any other reason why you could also be losing bone? Because there are other conditions that could make you lose bone besides osteoporosis, and a blood test can help determine that. I hope that answers your question. If not, do come back to us.
Is there any questions from anyone else? Actually, I have a question, Dr. Ong, pertaining to the loss of the bones density. Okay, you did mention about the peak, the peak of the person growing, it's the strongest and where they grow taller and they have the better bone mass, right? So why is it that you hear in a lot of cases, right, that even for older people, why is it always common that they will break their hip? I mean, if you talk about the cycle up, all right, and then at a certain age, then they would decrease. But why is it always that I hear, or maybe correct me, I'm being a lay person, I always hear of people, older people, breaking the hips more than anything else?
Okay, that is a very interesting question, because the question alludes to why older people are more likely to break their hips than, say, your wrists or your shoulder or other places. We think that the mechanism is how they fell. So when, say, you and I or a younger person has a fall, there are certain compensatory mechanisms that happen internally that protects our core and the parts of the body in the middle, like our hip and our pelvis, which shield it from breaking. So we think it's a very intuitive, instinctive means of shielding us from serious injury. So we tend to break our wrists, our arms, our elbows, and so forth when that happens. With older people, when they fall, they somehow lack that, or due to the way your muscles and nerves don't function as well, they fall and they lack that compensatory mechanism to protect and shield the middle parts of their body. So they fall and they break your hips, unfortunately. So it is an unfortunate event, and you're right, as we get older, the more likely part to break is the hip. Whereas with younger people, we do see a lot more wrist and shoulder. And then the ones who are sort of between the younger bits and the older ones tend to break their spines a little bit more. But they are, you're right, age preferences to certain parts of the body that are more likely to break.
Yeah, I thought that's rather interesting. Now it makes a little bit more sense. As you grow old, when you fall, it's the fall that actually dictate the bones where it will be broken, I guess. Yeah, that's interesting, because I always hear about older people having that issue. So it's just like kind of curious, why is it always that area?
Excuse me, I have a question, Dr. Ong. So I'm 59
can you tell your
years
name,
old.
please?
Yeah, Chia. I'm
Okay.
Chia.
Yeah, Miss Chia.
Okay. So I'm now 59 years old, and then I did my bone density test last year. So it shows everything normal. So may I know, actually I should do it every year or every 2 years? So to find out whether my bone density, is it okay or not?
Okay. We would only recommend as a minimum interval of 2 years if it is
Or
normal.
2 years, every 2 years.
At least 2 years minimum. So you wouldn't do it any shorter than 2 years. So if you want to repeat it, do it in 2 years time.
Okay, okay. Thank you.
No worries.
I think the DXAR scan is quite a accurate way of measuring, right?
They are, no test is perfect. Every test will always have some limitation. And the limitations could for DEXA might be how the patient is positioned, how they were laid down, whether, things like whether the machine was serviced recently or is there a fault within the machine itself. So there are many variables to the scan and the results that you get from the scan. So an experienced technician and an experienced doctor that will interpret the scan would be able to look beyond potential limitations with the accuracy to come with a meaningful result. So there are ways to go around it, but you're right, no scan is perfect, but hopefully the right scanner, the right technician, and the right doctor interpreting the scan will give you the most accurate result possible.
There's a question for Dr. Ong, Vivian Tay. Is it true that blood thinner medication will cause osteoporosis?
There is an association, okay? So recently we've heard a lot about this thing about association, not causation, in reference to COVID vaccines causing harms and bad things to people. But there is an association that has been reported that drugs that thin the blood, and we're talking anticoagulants is the term for these types of medication, and thinning of bones. So it is an area of interest, but for many people who take osteoporosis medication and also on blood thinners, we wouldn't recommend you stop taking one or the other, but to always have a sensible discussion with the doctor who's looking after you to weigh up the risk and benefit. In my practice, continuing both is absolutely fine as long as the indication for both is required.
Can add on a bit to that also, since I'm pharmacist. So according to our guidelines, so for our Malaysia guidelines, they actually note that heparin, which is one of the anticoagulant used, might increase the risk for osteoporosis. However, more recent guidelines suggest that the association between this coagulant use and also the risk of fracture is conflicting now. So it's actually not possible to form a recommendation yet. Like, is there really an association between an anticoagulant and also osteoporosis? So what we'll suggest is, like Dr. Terence said, still continue with both.
Hope that answers your question, Vivian Tay. Hearing the three of you sharing your expertise on this field, it all boils down to really early prevention. And I think also if you're genetically, if somebody from a family members do have it, I think all the more so we should take preventive measures even at a much earlier stage. Just now as I was saying, the peak of the bone, prior or during that time, I think it's the best to really build up the healthy bone.
Yeah, and this point reminds me of what Dr. Lei has said before in the past, that sometimes when he sees a patient in clinic and the older person comes in with the daughter, he will also ask the daughter, have you ever yourself considered your own bone health risks? Because unfortunately, with osteoporosis, it's not that there's a genetic element, but we know that if you have a first degree relative who has osteoporosis, your risk is higher than someone who doesn't have a family member with osteoporosis. So it is something worth thinking about, certainly in any of our younger audiences.
Yeah, that's true. Yeah. I have a question from Gabriel Chin. I think it's Dr. Gabriel Chin. Will antacid or proton pump inhibitor affect calcium absorption?
Yeah. So I
I
can.
think it's to Ms. Chia, yeah.
Sure. So far, just now I've also mentioned a bit about it, the proton pump inhibitor and also the calcium. So far, the interaction is mainly between the calcium carbonate only. So that's why they actually suggest you to take calcium citrate instead of calcium carbonate if you are taking proton pump inhibitor. But other than that, it's okay.
Thank you. I hope that will answer your question, Gabriel Chin. Anybody with any other questions? Again, you know, I'm shocking to see the results of the figures that was shown by IOF about our intake of calcium and stuff like that. I'm really shocking, especially the vitamin D. And it's like, oh my goodness, we have plenty of sunlight. You know,
But we are not going out.
Yeah, that's the problem. I think it's also to do with our lifestyle.
A sedentary lifestyle. IOF, they have recommended if we can just go out before 10 a.m. and after 2 p.m. for at least just 10 to 20 minutes to expose yourself to the sunlight, your hand, your face, everything. And make sure don't put on any sunscreen. That will actually block the sunlight. Yeah.
Oh, but then you have also this conflicting thing that, you know, too much of sun, you know, you have extra, those SPV kind of stuff. Yeah, you know,
that's why
cancer causing and stuff like that.
Yep. So that's why they're recommending 10 to 20 minutes. That won't cause cancer. Don't worry.
And especially the time is actually before 10 o'clock in the morning or after 4 o'clock in the afternoon. And another thing that we can recommend to our older person is actually when they are exposing themselves to the sunlight, remember to open the windows, because most people will just sit in the house and then to open the curtain, but the glass will actually block the UV light that will actually stimulate the production of vitamin D. So you need to have a direct exposure, not passing through the glass or the window.
That was my thoughts, actually. Oh, I see. So we should be really out in the open.
Yes, true.
Okay, okay. All right, that's good information. Anything else from anyone? If not,
I just imagine that going out in the open is not very Malaysian.
Yeah, we'd rather be stuck in a mall, you know, shopping and eating in the mall, eating unhealthy food. You know, that's where probably Mr. Mark will pull his hair out. I think really is our lifestyle. Maybe perhaps, you know, from where we were and where we are now, we're pampered with a lot of varieties of things that, you know, we can consume. And it's packaging, you know, whether it's healthy or unhealthy, it's like a trend to have this now. You know, so it's really a lifestyle.
That's true.
It is, because at the end of the day, if we adopt certain lifestyle behavior, then the need for chronic disease management in later life is much less. Then you're less likely to take drugs and need to see doctors and so on. So although a lot of the time we talk directly to problems pertaining to older people, but much of it has to be directed to younger folks as well, because how we live our life now determines what our older age is going to be like. Although I look after older people specifically, I would like to see less people and drive myself out of business if possible. And that's where we have to take a stand. So I hope with our participants today, you've got something to take away and reflect on, and not just for yourselves, but younger relatives as well as older relatives as well.
I have one question from Felicia Ng. Is there any truth in calcium supplements associated with the risk of dementia in older women?
Okay. So far, actually, there are studies, they found this association, but do take note that studies, they found that it's just in those women that has cerebrovascular disease, which women that has stroke. And also the findings is quite limited. So far, there are not enough evidence to support this association now. So we wouldn't say that there are link between calcium supplements and dementia at the moment.
Yeah, the only thing I add to that is sometimes with this type of questions, say, does calcium lead to dementia? We know internationally millions of people take calcium, and we don't see of the millions and millions of people who take calcium,
Dementia.
millions and millions of people develop dementia. So there will always be some association if you look hard enough at certain things, but in terms of will it cause dementia, it is unlikely. The important thing is, as what Mr. Mock and Ms. Chia has demonstrated today, calcium intake in our country is unfortunately not very high. I have vivid images of my grandmother growing up, when she was in her 60s or so, scooping Enlil milk powder and then mixing them up to drink very regularly. So I don't think my grandmother understood osteoporosis or what it means, but I think she knew that she needed enough calcium to maintain a healthy bone. And I think that was absolutely spot on with her.
And also, I think one thing that we always emphasize is benefit over risk. Although, like I said just now, there might be a link between like your calcium and kidney stones, which a lot of people are worrying about. But we are always mentioning benefit over risk. So is the benefit of you taking calcium supplements for your bone health more than the risk? Then you should just take it.
What is there a situation where you have excess of calcium? Just wondering.
Yeah.
What will happen?
There are some symptoms if you have this hypercalcemia, I think it's called. A few symptoms are like nausea and vomiting, and also you might feel dehydration, constipation. There are some symptoms of it, but very rarely people get over calcium from just like diet and also supplements. If you are not taking like 10 tablets per day, yeah, that usually won't happen, because our like upper limit of the calcium supplementation for older people more than 50 years old is up to like 2000 mg, and for younger people is 2500 mg. Only after that you might have the risk of getting hypercalcemia and also the symptoms, but it's quite unlikely. Yeah.
Just wondering. Okay. Is there anything else from anyone who would like to share or have any questions or query to our panelists? Well, okay, looks like not. But I had such a good time listening to, the three of you, because to me it's really had quite an eye opener, so to speak. Like like supplements. I never knew there's so many things involved in just a supplement. For consumers like me, I would just go to the counter and say, "Can I have this?" And then I would never want to ask, what is the effect, or what is the excess of this, or I would not have bothered to look at the back, on the table. I would not have. I think it's educational because people like us and us listeners here, we're learning something here about what we should look out for. I think it really is very good information. And even Mr. Mock, like diet, okay, what am I going to have today? It's going to be some sumptuous meal, but it contains nothing.
That's true.
I would have just a nice full stomach and a good time eating it, but it's of no effect to my body.
You might feel full, but it's basically not providing any nutrition.
Yeah. And we learn about a balanced diet from when we were at school, but as we grow older, there is no such thing as a balanced diet.
Everything comes to pleasure.
Yes. Yeah, and Dr. Terence, thank you so much, to all our panelists of speakers. And I think we will end here. Yeah. For listeners, look out for our next webinar. We will keep you all posted on our Facebook. Do keep an eye open. Yeah. Thank you so much to our panelists.
Welcome.
Okay, thank you very much.
Thank you for having us.
Thank you.
Okay.